Hi, my name is Chelsea James, and this is a response to the case study in Chapter 5 of Fundamentals of Christian Counseling. This is case study 5.1, and it starts with your client is a 56-year-old male who has talked with you over the phone prior to your session in order to set up an appointment with you. On the phone, he struck you as suspicious and seemed to be interviewing you with cautiousness, thoroughness, and a sense of mistrust. These were the underlying emotional themes you picked up on in the 5-minute conversation. He also described his situation as urgent in terms of a relationship ending that means a lot to him. You respond to his urgency by scheduling him for an appointment later in the day, since one of your appointments is canceled and he should come in at that time. So, first off, we're going to start off with a plan of action on how to approach this counseling situation. Considering that the client seems very untrusting and skeptical, almost to the point of paranoia, I would make sure to create a calming environment for us to meet in. The first meeting could make or break his attempts to healing, so empathy, honesty, and being genuine with his client are going to be very important. With his suspicious nature, he will be able to detect if you are being fake with him. So, building that rapport quickly is necessary to alleviate any suspicions that he may have about you or counseling in general. The discussion on the phone indicated that your client could be suffering from a couple different disorders. The paranoia and untrusting nature could be the result of substance abuse issues or PTSD. In an effort to be prepared, I'll have resources and information on both issues ready to discuss, as well as some suggestions on healthy coping, healthy relationships, toxic traits, and maybe even codependency, if I feel that that is the case. If he might be suffering from some codependency issues. Um, Main thing to remember is the counselor's role in a crisis is to assess, stabilize, and develop a plan that includes resources. Um, this is straight out of Fundamentals of Crisis Counseling. So, for an individual counseling setting, individual counseling in general needs to be a safe place where the client can sort out sensitive, personal problems. The counselor needs to be an anchor for the client while assisting the client in personalizing information about the changes that need to be made. Um, During the intake, I would try to let him take the lead and do most of the talking. Given his skeptical demeanor, I'll be prepared to talk more than the 20% suggested in order to gain adequate information for his treatment. Some Socratic questioning could be useful with this client if he's not forthcoming with information. We would also discuss feelings about the relationship and possibly touch on some codependency concerns if that was the case. Um, I would also take this time to address any skepticism he may still be projecting in hopes that we can either ease his mind or find the reasoning behind his untrusting nature. I would possibly also use some techniques from CPT that can help debunk negative thinking patterns. With the recent breakup, he may be harboring feelings of being unworthy or hopeless, or have other negative feelings about himself. Examining what social, cultural, and economical factors may be negatively impacting this crisis may help to put things into a different perspective for him. We would also come up with a service plan to discuss the goals moving forward. The client did disclose that he has a history of PTSD. So, if his paranoia and untrusting nature is due to PTSD, I would do the initial crisis intervention, display empathy, remaining genuine, honest, and firm to gain some form of trust and to calm the nerves. I would let him talk, let him get all of his frustrations and emotions out around the breakup. I would discuss his PTSD with him, how it works, and treatment options. I would stress the importance of getting treatment. I would then explain the use of the multimodal therapy, emphasizing behavioral and cognitive behavioral therapies, and I might also suggest some CPT for his PTSD. An assessment to evaluate his level of PTSD could then be scheduled. Groups can help clients with a sense of isolation because they are focused on forming and maintaining relationships. I encourage my new client to attend this group this evening. Loss of relationships is the focus of this group. However, while in group, he starts crying uncontrollably in the group while others are discussing their relationship losses. At this point, I may tell him that he can take a minute outside if he wants, but the fact that he is crying at other members' experiences can be very powerful in helping him not only realize that he is not alone, but he may also gain some personal accountability from others' stories. So if the group is not affected by his crying, I might just let him sit there and cry. It's also showing vulnerability with people. He may not be sharing, but he is letting some of his walls down to display such strong, genuine emotions. And this is important considering his demeanor on the phone. So I would pay close attention to what he's hearing and how he is reacting to what is being said. Groups can be both powerful, healing, and powerfully destructive. This is right out of Fundamentals of Crisis Counseling. So, is his crying due to sadness over the breakup or hearing other stories he can relate to? Or is the discussion embedding a sense of hopelessness that could possibly cause more damage? Further sessions may be needed with the client before having him return to the group, or this may be just what he needs to begin trusting people again. Maybe he needs a space where he can be genuine. The case study did disclose that his ex-girlfriend's family treated him very badly. He may need a space where he can be himself. So in this scenario, the client shows up with his recent girlfriend, the one who just broke up with him, the one that he is seeking counseling to overcome. Um, this was supposed to be an individual intake. So my first instinct would be to have the girlfriend wait in the lobby. However, this dual encounter may give much needed insight to the relationship. Since the client seems suspicious about you on the phone, this may offer some needed information that would not get disclosed otherwise. I would invite the couple in and then explain to them that for this session, all I am doing is listening and observing. Any questions that I ask will be purely for understanding. I would have them sign consent forms before proceeding. Counselors need to be clear with their clients from the beginning in written guidelines as to the limits of confidentiality, since counselors may vary in terms of how they structure counseling, whether it's individual, and then couples counseling, or however they structure counseling. It needs to be clearly disclosed. The reasoning that I won't be giving any advice or suggestions in this session is because she is not my client, he is, as of right now. And I would not want to block the potential for a positive therapeutic relationship between myself and the client. I am unaware until later if she wants to partake in couples counseling or not, which she later discloses that she does not. She believes the breakup was needed. So I will help my client to understand what his ex-girlfriend is trying to say if he needs or if he seems to be getting the wrong idea or false hopes. And I will ask questions just to gain a better understanding of things. At the end of the session, I would probably have her step out. And the last of our session would be just me and my client, and I would make sure that he is emotionally okay. We would debrief about the conversations that just took place. His emotional health and safety is my first priority at this point. So doing a mental health check with him will also show him that I am empathetic to his situation and may help with building that therapeutic relationship. I would then ask to see him again and make it clear that this is an individual setting from this point on. Given the harshness of the session, I would possibly schedule for a couple days later if possible instead of like a week later. If he could not come in until the next week, then I would definitely do a follow-up call to check in with him and make sure that he is still okay. So with factors relating to the different scenarios that we encountered on this presentation, there definitely needs to be a discussion on confidentiality when the situation changes from an individual to a couple session. In this particular situation, a confidentiality agreement would be signed, and I would advise them that this is a safe space and that everything said will remain confidential. I would also advise the client that while I have to remain confidential, having another person in the room can cause a breach in that confidentiality by the other person present. In a group setting, you should explain the confidentiality agreement and let them know that while everything is supposed to be confidential with a group of people present, that confidentiality may be breached by someone in the group. In my own profession, I encourage them to share. However, I ask them to refrain from details that could harm them if the wrong person got a hold of the information. In relationship to age, gender, race, and sexual orientation matters, I would take the client's age into consideration when discussing options for treatment. Okay, as far as groups, I wouldn't put him in a group with a bunch of 20-year-olds. He is 56 years old. So I would put him with a like-minded group with that probably share like-minded ideas and values and morals. Um, so the age is what I would take into consideration at this point. Um, that is all. Thank you for watching and have a great afternoon. All the information that I have included in this presentation came from Chapter 5 in Fundamentals of Crisis Counseling. Thank you.